Hi YouTubers! Hi YouTubers! Hello everyone, welcome to my channel. My name is Mandy. So today's topic is postpartum care. The first era after birth once you have delivered the placenta and the baby. Welcome aboard. I knew giving birth would be difficult. I mean, you hear that a lot, you know, it's gonna be painful, so be ready. But like people don't normally talk about for surprise. And I was very close some days to having baby blues. And I think it was due to the support that was around me that helped me to overcome those challenges, those great days that I had. So that is why I kind of want to discuss this today. If you're not properly prepared for it, that can lead to a lot of different issues such as baby blues, postpartum depression, and other issues, infections, and having to go back to the hospital back and forth. So I just think it's a big topic to talk about. It's something all women go through. I think discuss and be prepared to go into this journey once it happens. So hope this video is informative and you can learn something from it. So thank you very much for watching my video. Let's get started. Number one tip that I want to talk about is to listen to your body. You hear me? Listen to your body. So that means you have to listen to your body. So if you feel that you need to rest. If you feel like you're doing too much, maybe you are doing too much. If you feel like whatever you feel, just listen to your body. If you need to rest, take a rest. I know you're new. I know as a new mom, you know, you feel like you can do it all. You want to push yourself to the max, and you know, you want to take care of this precious baby that you just had. You don't really want to stop. You know, you feel it's like even if you have help, you don't really want to rely on them. You think you can do it all. Us women tend to think that sometimes, but listen to your body. Listen to your body. You need to listen to your body because if you feel like you're doing too much, you're doing too much. If you feel like you need to rest, maybe you need to rest. Rely on your support system around you. Because if you don't, that can prolong the postpartum recovery process, and also that can cause you to have to go back to the hospital to like infections and so forth like that if you're not properly taking care of your body. You just push out a big old baby out your body, push it out, or came out vaginally or C-section, a baby came out of you. That's the point. So your body needs to recover. You have to understand that your body needs to recover. So first tip that I want to say, number one, listen to your body. Listen to your body. If you need to. Two, I will be discussing the vaginal bleeding that occurs after you have delivered a baby. Vaginal delivery, you will bleed down there. Cesarean delivery, you also bleed down there, in case you did not know. Welcome to motherhood, okay? Welcome to motherhood. So vaginal delivery, in my case, that was my experience. You bleed a lot, a whole lot. Not only do you bleed, I don't want to scare anyone. The amount of discomfort that you feel depends on each person. Honestly, some vaginal deliveries doesn't consist of tearing. Some consist of tearing. If you tear, of course, you're gonna be more discomfort. It's gonna be more painful. And of course, if you have a cesarean delivery, of course, that is way more painful because that's a major abdominal surgery. So, but either with vaginal delivery, tearing, no tearing, or cesarean delivery, there is also all of these consist of bleeding in your vajayjay area. So that's what things that can help with that is the mesh panties at your hospital, your birthing center, your birth center, your hospitals will give you the mesh panties when you're in the hospital. You can also purchase those online. Amazon has mesh panties. You can purchase, typically you just wear them one time and you throw them away. You don't wash them or use them again. With the mesh panties, it's one size fit all, I believe. Put this inside the mesh, you break it. I don't want to break it now because I don't want to waste it because I don't need it. But you break it and then you put it inside the mesh panties, and basically it's like an ice pack. It just kind of cools your vajayjay down a little bit. So you put the mesh panties, you put this inside of it. At least you change this every 2 to 3 hours. You put a fresh one on. At least for the first 2 weeks, in my case, I needed this. Afterwards, I didn't need it as much. But it feels like your vagina's on fire. So instead of wearing a regular pads or long pads, you wear this the first 2 weeks. until the fire feeling, your vagina start healing, then you won't need this anymore. You can use those regular big pads or like the discreet underwear that some women wears. But this is useful. My advice to you is this is very, very the perineal, I don't even know how to say this honestly, but this is very useful. My advice to you is, for my case in my hospital where I gave birth to my baby, they didn't give me any much to take home. They gave me like 1 or 2, but this is what I learned to do. You don't have to take my advice, but like they would give me the mesh panties. They would give me these like every few hours, and I would just stack those to the side. Okay. You didn't hear that from me. I would stack them to the side, and that is why now I still have a whole bunch of these left, and I don't really need them anymore, because unless you want to buy, I don't know if they sell these at Amazon. I didn't buy them, but these are needed. Trust me, believe you will need these. So I got it from my hospital. I just would ask for extras, and then to make sure that by the time I went home, I had a whole bunch. Like I said, you will be changing this every 2 to 3 hours, so you will need a whole lot of it, a whole lot. In the mesh panties, so that's what I wear for like the first 2 weeks. They gave me this little squirt bottle. I don't have it now, but it's very, very useful. The hospital gave it to me. I actually had 2. You put warm water in there, and then when you go to the bathroom to do a number 1 or number 2, whatever, you would just squirt it down there with warm water. Just squirt the water on your area, and that feels so good. Like it feels like, because like I said, your vagina is on fire. So that warm little water that you spray on there makes it feel so good. So you will need that little squirt bottle. They actually sell those on Amazon, but your hospital should give you one, or your birthing center should give you one. But squirt bottle, the mesh panties, plus these all must. In addition, honestly, if you feel like you need it, I didn't purchase it, but next time for me was difficult. Because it just hurt a lot. See, I'm touching my butt like it's still hurting now. But sitting was very difficult for me. So what I would recommend is, you know, those donut pillows people use to sit on. You can buy those on Amazon. I think it is definitely useful, because sitting will hurt. Because like especially if you have tearing down there, it's gonna hurt. It's difficult for me to sit. Mind you, if you have a baby that you're nursing and caring for, you're gonna need to sit. You're gonna want to sit down, and if it's hard to sit, every time you sit down, it feels like your vagina's on fire. You know, that's very painful. If you could use something to kind of take away any of that pain or discomfort, why not use it? And those things are not very expensive. So a donut pillow would highly recommend if you have tearing in your vagina. So those things I would definitely recommend for vaginal bleeding. It will help you a whole lot. So please get them. Number 3. So number 3 would be using a stool softener. In my case, when I went to the hospital, they gave me some before discharge. They gave me a prescription script so I could buy some once I got home. Softener would be helpful with vaginal deliveries and cesarean deliveries, because after you have delivered your baby, typically it's very difficult for you to do a number 2. It just feels you're very constipated. It's due to the medications. It's just due to, you know, your body, you know, basically your whole baby came out of it. So it's very difficult for you to do number 2. You're very, very constipated. So a stool softener will definitely help for you to go to the bathroom. It is not a laxative, so it will not make you just go randomly anywhere. But it's just gonna help you when you need to go to the bathroom for it to come out. Because trust me, if your vagina is on fire, your stomach's on fire, you don't want your butthole to be on fire. So use a stool softener. It comes in handy. We need stool softener because you will be constipated, and you would definitely. The next thing I want to talk about is, I think this depends on some cultures, but some cultures believe in using herbs, and some other cultures believe in like vaginal steaming or using herbs to kind of help We nourish the body, we nourish the vajayjay, clean the vajayjay. So if that's in your culture, something you believe in, they have vaginal steaming where they use various herbs, and you sit on this thing, and then it kind of this steam goes up your vajayjay. It kind of did this for me after my delivery. So it's different. I don't know what the herbs name, but different herbs that they use to kind of help you to kind of nourish your body back. Even there is something that's in your culture, the vaginal steaming with various herbs, or you could take a bath or shower, and herbs that can be helpful for you. At least it could be the placebo effect. If you believe it's working, maybe it's working. So if that's something you want to try, you could try that too. The fourth thing that I want to talk about is nutrition. Nutrition. So you need to fuel your body with healthy nutrients that will help sustain you and help your body to recover. Lots of fruits and vegetables, protein, and a little bit of carbs. You just had a baby, your body needs to recover. If you're breastfeeding your baby, you need to have healthy nutrients in your body to give your baby good milk. That good milk, as they call it. If you're not, you just need healthy nutrients. Your body, you just push your baby out, or you had major abdominal surgery, so your body needs to recover. You need healthy nutrients. Eat plenty of fruits and vegetables, protein, and a little bit of carbs. So make sure that. The item that I want to talk about is swollen feet. Not everyone get this. I understand that. In my case, I had it severely. I had swollen feet during my pregnancy, but after giving birth to my baby, it was very extreme. So my feet were swollen to the point where it was hard for me to walk. It felt like my feet were going to explode. So going up, down the stairs was very difficult. During the night when I would elevate my feet, in the morning when I wake up, there would be a little bit less. But as you know, if you walk on them and things like that, it will get swollen again. The swelling, honestly, did not go away until the third week after I had my baby. And the swelling happened, they said, due to fluids that you receive during the delivery process, and those fluids need to come out, and it may take about 2 weeks for them to be completely gone from your body, 2 to 3 weeks. They will be released, when you urinate and things like that, but they will take some time for the swollen feet to go down. That can be very painful, so be mindful of that you may have swollen feet. If you need to kind of help them, for them to go down a little bit, make sure to elevate your feet at night, and also listen to your body again. Rest when you feel like you need to rest, stay off your feet and things like that. But just be aware that if it does happen to you, it will go down within 2 to 3 weeks. You will get your feet back again. It will be difficult, it will be painful, but just elevate your feet, rest when you need to rest, and know within 2 to 3 weeks they will go away. The next topic that I want to talk about is mood. Mood management consists of being aware of your emotions, being aware of your feelings, being aware of your thoughts, being aware of that impacts the care of your baby and impact the care for yourself. Mood management is important because that can help you to recognize when you have baby blues, and that can also lead to postpartum depression. I don't know, I think my mood was just all over the place, happening. Did I really give birth to this baby? This is legit, I'm a mom, so dealing with that, processing that, the feelings that I'm a mom now, and dealing with, all the pain and discomfort that I was experiencing was very hard for me. But I had support. My mom, she was champion. She is MVP for the best support system ever. Definitely recommend for you to have loved ones come stay with you after you give birth to your baby. Or if it's not possible for them to come stay with you, if you are able to go stay with them for a few weeks, at least the first week or two during your postpartum recovery, because trust me, you will need that support. For me, honestly, I was in so much pain, I couldn't do a lot of things. So having that support was very, very needed, and I truly appreciate it. But having a support system is definitely fundamental. There were a couple of days where I felt myself having a baby blues, where I just was kind of not depressed, but sad. There was a time where I think someone said something to me where you're not doing this properly or something like that, and to me that was so hurt. I took that so deeply, and I started crying, and the next day I found myself crying again. And then I was my husband was are you okay? And I'm I don't know, I'm miserable, I hate this, my feet are swelling, I'm in pain every single day, 24/7, I'm in pain, I'm miserable, like I hate this. Like I just check in with my support system here. This is what's going on. This is what's making me feel this way. Talking about my emotions, talking about how I was feeling, how to change your perspective a little bit, gain a new perspective, gain support system, and maybe alleviate the severity of the sadness, the discomfort that you currently are feeling. Because now you get to talk about it. Maybe now someone will, okay, we'll see that you're depressed, or maybe you're not feeling the best today, will kind of help you to get you out. Postpartum depression occurs because of this reason. During pregnancy, you have high levels of estrogen and progesterone in your body. But within 24 hours after you have delivered your baby, these hormones quickly drop to their normal levels. And because of the rapid change in the drop, that can lead to postpartum depression. So being aware of that. Many women actually suffer from postpartum depression. At first it starts from baby blues and leads to postpartum depression. The severity of the postpartum depression varies for each person. But I definitely recommend, if you have baby blues for the first 2 weeks and it continues for more than 2 weeks, I highly recommend that you speak to your provider, you speak to your family members, you speak to your loved ones, and you ask for support, because they will evaluate you and determine if you have postpartum depression. If the baby blues last longer than 2 weeks. But there are always factors for postpartum depression, which goes with the mood management that I discussed. Factors are those having negative thoughts, such as worries about being a mom, feelings, any negative feelings that you have about the postpartum recovery process, being a mommy, being a new mom. All those things can lead to all those things are risk factors for postpartum depression. So, which I mentioned, mood management is fundamental. So being aware of your emotions, being aware of your thought processes, talking, once you're aware of them, you can then talk about them to your family members, to your loved ones, and get the support and the help that you need, because you can't change something if you don't recognize that it is happening. These are my tips. I hope you find them useful. I hope you can learn something from my video. Please comment below any videos that you want to see from me in the future. Please subscribe to my channel. Please click the alert button so you get notifications of when I post new videos. Take some tips from my video. And congratulations, if you're a new mommy like myself, congratulations, you're currently pregnant. And if you're hoping to be pregnant and just watching this video, I hope you get your wish. If you're watching this video for a loved one of yours, thank you for watching my video. Please share, please support, please like, please subscribe, please comment. Bye.